When I was 20 years old, I lost my stepdad to suicide. So he'd been in my life for 16 years. And I'd received a phone call the night before and had a beautiful conversation with him, and I got a text message that morning. But I didn't know that he was contemplating suicide. I didn't even enter my mind that that was a possibility. So I got a phone call at work telling me that my stepdad had taken his own life, and I think when you receive that phone call, it's kind of like, for a moment you think you're dreaming, this isn't real. And then after I thought about my stepdad and that happening, I immediately thought about my little brother, who was his son, who was 10 years old at the time, and thought, how am I going to support him? How's he going to be okay? So 6 years ago, I started a not-for-profit or a charity called Zero2Hero. At the time, it was just to raise awareness and reduce the stigma and start conversations about suicide in order to prevent it. And during this time, I got really interested in the massive scope of suicide and mental health, and that there was a lot being done in the pointy end when people really needed help, but how did we prevent them from getting there? So created a range of school programs, and Zero2Hero is now in over 80 WA schools and speaks to hundreds of thousands of kids every year, which is pretty cool. And we teach young people how to prevent suicide. So upskilling the young leaders within WA high schools in suicide first aid or suicide prevention. Things to look for, cues and invitations for people that are really struggling. Things that if I had have known at the time that I lost my stepdad Graham, I could have possibly prevented it, or I definitely would have handled it very differently. Changes in moods, changes in sleeping patterns, eating patterns, and just general behavioural cues that are quite obvious once you know them. And then how to go one step further. So, cool, we've identified it. Now let's have a conversation, and what do I say and what do I not say?